Awesome. That's my cue. So good morning. Good morning. My name is Elizabeth Probst, and I'm the Community Outreach Coordinator here at St. Jude, part of the Infectious Diseases Department. We're very excited for everybody that has joined us. And so without further ado, I'm going to go ahead and get us started with today's End HIV 901 Technical Assistance Training for today, April 23rd, 2024. It is my pleasure to introduce our consultant for the hour and a half, and our consultant is Jasper, also known as Jazz Joyner. So Jasper, also known as Jazz Joyner, they them, is a Memphis-based Black trans masc author, journalist, poet, and editor of the LGBTQ magazine Focus. Their chapbook, A Flamboyance with Bottle Cap Press and YA fantasy novel, Juniper Leaves, are now available. Their book, Pansy, a Black American memoir, will be out in October 2024. With that being said, the quick reminder courtesy I will drop before I turn the mic over to Jasper is if you are not talking or presenting, please be sure to keep yourself on mute as well as keep your cameras off. I appreciate everybody once more for joining us. And with that being said, I'll turn it over to you, Jasper. Thank you.
Thank you so much. As Elizabeth said, I'm Jasper. I'm very happy to be here. This is going to be training on media, journalism, and the HIV/AIDS epidemic. So without further ado, we'll go ahead and get into it. That's me. My name is Jasper. You can also call me Jazz. I go by pronouns they, them. Um, I'm transmasc. That means I was assigned female at birth incorrectly. I am a journalist and a poet and editor. The reason I mentioned transmasc because we're going to talk a little bit about how gender expansiveness isn't really talked about in media when it comes to HIV and AIDS. So just to give a little context with that, I have been in media for about 10 years now. I started at Time Out New York, working as a journalist and editor over the years, Huffington Post, etc. So I'm coming to you as a media expert and a supporter of HIV/AIDS awareness and education. So what this training is going to be focused on is really trying to bridge the gap between how HIV and AIDS has been represented in media, the issue of that, history of that, and how we can do a better job as HIV and AIDS awareness advocates, and also the media and people like me in media that can make stories that people are drawn to and interested in to help raise that awareness. All right. So the agenda today, I'm going to be glancing at my notes here. I have about 13 pages of notes. If I'm looking down, that's what I'm at. So we are going to go through about 5 major topics here. So we're going to start with a brief history of how HIV and AIDS has been represented in media since the first cases of it were reported in 1980 in Los Angeles, all the way to now, 2024, what we're dealing with today. And then we're going to move into the state of media and why the state of media is what it is. We're going to talk about some statistics with that and connect it to directly connect it to what HIV and AIDS awareness is now, and how the media has helped shape that. And then we're going to focus a lot on the local aspects of that, because right now, moving from a pandemic to an epidemic, and having the southern states be kind of the focus on that, and marginalized communities being a focus on that in the South, we're going to really talk about that and how local media affects the rise in cases, honestly. And then we're going to round it out with a summary, little moment for discussion. I'm going to ask a couple questions with this. This will be semi-interactive, so any of you that are open to speaking a little bit, I will have a couple questions throughout this. But yeah, that's going to be kind of the scope of things. All right. So HIV and AIDS media coverage over the years. We are starting with the very first cases of HIV and AIDS in the early 80s. The first reports of it were in a bulletin, government bulletin. It was the Morbidity and Mortality Weekly Report bulletin. It was not a major story. It was not a top story. And it was called the Perplexing Disease Cases. They didn't really even have a name for it. So it was in June 1981, and the piece said, in the period October 1980 through May 1981, 5 young men, all active homosexuals, were treated for biopsy confirmed um, what they called pneumonia at 3 different hospitals in Los Angeles. 2 of the patients died. That's how it was reported. Um, so in its early stages, in its early framing, of course, the media took the lead from this bulletin and were calling it gay pneumonia, because all 5 of the men were homosexual or gay, which obviously was, from jump inaccurate. But the media held on to this gay pneumonia stereotype, and that's still a stigma that we deal with today. But that's just how it was covered. So around the same time, we have the Reagan administration in office. A historically poor response to this. The first 4 years of the Reagan presidency, there was literally no mention by Reagan of AIDS. No, he never said the word AIDS in his first 4 years in office. Um, but it wasn't even just that he didn't speak to the issue, but when it was discussed or when you would hear about Reagan and HIV and AIDS, it was always very negative. So there was a short documentary called AIDS Was Funny that came out that shared audio from a press conference where Larry Speaks, which was Reagan's press person at the time, was caught on audio calling the HIV/AIDS crisis the gay plague. And I don't know if some of you know that, like, actually in media at times it was mentioned as the gay plague. That's because of Larry Speaks and because of the Reagan administration. But not only was that audio caught, but the response to him making that joke about the gay plague, everyone in that press room, including the journalists, were caught laughing and, finding this funny, and no journalist in the room challenged him. So that's kind of the tone of what things were at this time. Um, there's a lot of stigma around it, a lot of disrespect about it, and it wasn't taken seriously at all. Which of course speaks to the homophobia of the time, but also just the lack of care for um, this growing crisis that was becoming a pandemic. The U.S. responded horribly. Reagan responded poorly. Um, so yeah, in the first part of his presidency, of course, no mention of AIDS. It wasn't until his second term that he mentioned AIDS. And around the same time, Rock Hudson, who was one of his good friends, some of you might know Reagan was an actor before he became president. Rock Hudson, who was a very popular actor at the time, sent a plea to the White House, um, basically begging Reagan to address HIV and AIDS. Rock Hudson was dealing with HIV at the time. Reagan did not respond in his first term. He didn't respond at all until he got word of his friend Rock Hudson being extremely ill from the virus. And then the same day that Reagan spoke about HIV and AIDS and mentioned AIDS for the first time in his term was the same day that Rock Hudson passed away from HIV and AIDS complications. So you see the direct link there. Um, the direct link of him responding to HIV and AIDS because it personally affected him. It was affecting his friend. So all of a sudden, after Rock Hudson passes, and there's a lot of pressure from media to to speak publicly about it, that's when the Reagan administration finally responds to it. Um, so we're going to move on to the next slide, which is around the mid to late 80s. There was this attempt to reframe the face of HIV and AIDS. Um, Side note, I don't know who has their sound on. Thank you so much. So yeah, so the mid to late 80s, there was this attempt to reframe the face of HIV and AIDS because, of course, as I mentioned, it started out being framed as the gay plague, right? So this is a picture of the Newsweek cover, The Face of AIDS, 1 year in the epidemic. And this came out in 1987. So for them to say 1 year when the first cases were reported in 1981 already tells you that the media has gotten it wrong. The media, the reason they're saying 1 year is because they've cared for 1 year, not because it's accurate. So I just want to make that point. But uh, the face of AIDS was their attempt to move from this idea of the gay plague into anyone can be affected by HIV and AIDS. Um, They also had a cover come out called Kids with AIDS that same year. So people like a lot of publications like Newsweek were really trying to recreate and like break the stigma that had already started around HIV and AIDS. Not necessarily successfully, but there was an attempt, and this is the attempt there. Um, but yeah, but even after this came out, it didn't necessarily help reshape things, but people that did read Newsweek, people that understood it, there were a few stories that came out around this time that did help change the conversation just a little bit. So this next picture is of Keith Haring, um, white gay man that was kind of the face of the epidemic at the time, not necessarily accurately so. He didn't represent everyone dealing with it, but he was diagnosed in 1987. And a lot of his later art in his later years was um, in direct response to his diagnosis and his hope to raise awareness about HIV and AIDS. Um, so I want to read this quote that he shared shortly before his death that really speaks to the way LGBT communities were uh, dealing with HIV and AIDS at the time. It was so pervasive in all LGBT communities, um, and it completely changed um, really every aspect of LGBT culture at that time. So I'll go ahead and read this quote. It says, AIDS has changed everything. AIDS has made it even harder for people to accept because homosexuality has been made to be synonymous with death. It's a justifiable fright with people that are just totally uninformed and therefore ignorant. Now it means that you're a potential harborer of death. That's why it's so important for people to know what AIDS is not. So that quote in itself really speaks to the way the media was treating AIDS. It was considered a death sentence at the time. Um, this whole framing of like living with HIV and AIDS didn't come about until years later. At this time, if you were diagnosed with AIDS, it was framed as a death sentence. It was framed as like, oh, you only have so much time. Um, Especially in LGBT communities, especially for gay men, which unfortunately are still the face of HIV/AIDS epidemic today. So we're gonna move on to Magic Johnson, who I cannot stress enough his impact on the dramatic shift in how we talk about HIV and AIDS. The way that a lot of stigma has begun to break down is a lot of that is credit to Magic Johnson coming out with his status in 1991. Because of course we have Keith Haring, who was the face, and then you have Magic Johnson coming out in the early 90s, completely breaking every stereotype that most people knew when they thought of HIV and AIDS. Um, so he had a press conference in November 1991. He was 32 years old, at the top of his game. Everyone knew about him, whether you liked basketball or not. He was uh, one of those people and just a major celebrity in the United States. Um, so he came out and he had a press conference in 1991, and a lot of journalists say that it's because the news of his status was about to come out and he wanted to get on top of his story. But honestly, thank goodness that he did and that he led his own narrative, because that press conference um, really shifted culture in a huge way. Um, and I want to speak to that. There were three, I'd say, major framings. I'm sorry, that's my dog. There are three major framings of stigma that he began to break with his press conference. And the first one was separating HIV and AIDS, right? So HIV is a virus that weakens your immune system. AIDS is a condition that can happen as a result of HIV infection. So he made that distinction. That's not something the media was really doing at the time. HIV and AIDS were, interchangeable. So that was really important. And he also challenged this idea of HIV and AIDS being a gay disease, right? As a straight man coming out with his status. Um, he said, I think sometimes we think only gay people can get it. I'm saying that I can get it and anybody can get it, right? And him saying that was huge, because a lot of people didn't care about this um, virus if they weren't in the LGBT community, or if they didn't know someone in this community. So that was really, really significant. And then um, he also challenged, I would say probably the biggest thing that he did was he challenged this idea of HIV and AIDS being a death sentence. This Around this same time is when we started, instead of framing it in the media as a death sentence, we started using the phrasing of living with HIV. That's, I would say, a big credit to Magic Johnson. Um, he said, life is going to go on for me, and I'm going to be a happy man. That sounds like a very simple thing to say, but at the time, that was a huge statement for someone like Magic Johnson to make. It was quoted constantly in a lot of media at the time. Um, and it was shocking to people. So people really caught on to that framing. And he did, dozens of interviews just talking about the fact that he felt that way, which a lot of people watched. So it was really, really helpful for him to use that. Um, and finally, I would say Magic Johnson arguably helped the Clinton administration um, speak more openly about HIV and AIDS. He endorsed Clinton um, in 1992. And throughout the Clinton presidency, there was a lot of conversation and stories around HIV and AIDS. I would say that the pressure in media connected to Magic Johnson coming out with his status probably did have a lot to do with that. Um, but of course, there was still a long way to go around this time. But a credit to Magic Johnson for that. So we're gonna pause here, because around this same time, early 1990s, a lot was happening in media when it comes to HIV and AIDS. So Paris is Burning. I don't know if y'all are familiar with that. It's a 1990 documentary um, about the ballroom scene in New York, focused on a lot of prominent people in that scene. And HIV and AIDS was a huge theme in that film. And we even talk about it today as one of the more prominent films about the LGBT community. So it's just, a testament to how uh, marginalized communities have always been on top of HIV and AIDS coverage, but at the time there was very little discussion of Paris is Burning existing. No one really cared. It wasn't really until, I'd say, at least a decade later that people started talking about this film. Um, but it was being talked about in the communities where it was affecting those people the most. Also around this time, Salt and Pepper put out a remix of their song "Let's Talk About Sex." It was called "Let's Talk About AIDS," and for these two Black women to make this song was really significant. Um, in terms of like helping to break that stigma about HIV and AIDS, and just being like, we can get it too. We have to start talking about it. We have to start letting people know that this is significant, right? So as as the media is kind of slowing down coverage of HIV and AIDS, celebrities, artists, and things are trying to continue the conversation, doing their best to continue the conversation. So then there's Philadelphia, came out in 1993, uh, and it was a film about a lawyer that hides his homosexuality and HIV status. Um, and the film won 3 Academy Awards. Tom Hanks was in it. Denzel Washington was in it. And this is just an example of how there was discussion about HIV and AIDS, and there were artists that were trying to bring it to the forefront. Um, was it successful? Not necessarily. Around this time, again, media was starting to care less about making these top stories. But it's just showing how the art and media is trying to put pressure on those in power to talk about it. And then it works sometimes, it works, it doesn't work other times. So we're gonna move on to the next slide. Um, we have to talk about Hadia Broadbent. Rest in peace, rest in power. She passed this past February. Um, but her and Magic Johnson, I would say, go hand in hand when it comes to shifting the discussion around HIV and AIDS, right? Um, so a lot of you might be familiar with her 1996 Oprah interview, but she did an interview in 1992. Let me look at my notes. 1992. She was 7 at the time, and this interview was with Magic Johnson. Um, she and Magic Johnson were discussing living with HIV, a straight Black man and a little Black girl discussing HIV and AIDS, and not about it being a death sentence, but about how they are living with it and they're okay. That was huge, and I would say probably led to the infamous Oprah interview in 1996. Oprah at the time the Oprah show had been syndicated for 10 years. So many people watched that show, and not only that, but her audience is not for people that were talking about HIV/AIDS at this time. So a lot of people who had never even heard of HIV and AIDS, this was their introduction to it. Um, and that's actually a wonderful thing because Hadia didn't fit the stereotype that the media was pushing about who can get HIV and AIDS. She single-handedly broke a lot of stigma around it simply for being brave enough as an 11-year-old at the time, talking about her life and living with it and being born with the virus. Um, really, really significant. But also around the same time, not only were people like Hadia and Magic Johnson shifting the conversation, but in real life, people were um, had more access to protease inhibitors at this time. It was a little more accessible than it had been, so people were living with HIV more regularly at this time. And Hadia was able to speak to that. Magic Johnson was able to speak to that. And it was just a really interesting time where people were learning, like, okay, this is something people can live with, you know. So it's significant and it's important, and I really want to give a lot of credit to Hadia, who really dedicated her life to HIV/AIDS advocacy and awareness and education. Um, so we're gonna move on to George W. Bush, who I have to give credit for the way that his administration in the early 2000s shifted the conversation around HIV and AIDS to a global framing rather than, you know, specifically the United States, because at the time, and about like 2003, George W. Bush and his administration talked about HIV and AIDS being the deadliest it had ever been, not for the United States necessarily, and not for richer countries, but for poorer countries around the world. So he made this commitment in a State of the Union address to combat HIV and AIDS around the world. It was the largest health commitment ever in the United States at the time. His administration committed 100 $100 billion to combating HIV and AIDS around the world. However, a lot of United States advocates at the time felt that moving and shifting this conversation to a global scale really took away from um, United States media talking about this as if it were still a United States issue. Because around this time, there had already been a decline in top stories about HIV and AIDS. Now, this is really when there was a huge decline. Because I don't know if y'all remember, but if you think of the early 2000s, this is around the time that there were a lot of commercials and uh, like commercial fundraisers about um, Black kids in African countries dealing with HIV and AIDS. That's a big credit to the Bush administration. So you were getting commercials about kids in African countries, but you were not getting any commercials or anything about the marginalized communities in the United States still dealing with it, who did not have access to medication in the ways that a lot of other communities in this country did. So it's kind of like a double-edged sword. Like a lot of things were done globally, but this is definitely around the time when like it became much more of an epidemic in this country rather than a pandemic globally. So it's hard to say that that really benefited marginalized communities here in this country. Um, so we're going to move on to the 2010s, um, which is almost now. We're almost present, and currently there is less coverage on HIV and AIDS than there ever has been. And kind of the only time that you're going to get information about HIV and AIDS now is if there is a celebrity attached to the story. That is pretty much where we're at now in media. So Billy Porter, who won I believe it was an Emmy for his role in Pose, where he played a character who also had HIV, um, came out with his status about living quietly with HIV for 14 years. And a lot of you might remember that was a big news story. That brought HIV and AIDS um, to the headlines in a way that it hadn't in a long time, because we're at this era now culturally where if a celebrity is not linked to the story, if it doesn't have an entertainment bend to it, you're not going to really see coverage on HIV and AIDS in a grand scale or like in the headlines or on a front page. Um, there also was author George M. Johnson, who wrote a memoir called, I think, All Black Boys Aren't Blue. I believe that's what it's called. I don't believe they talked about their status in the memoir, but as the memoir got super popular, they did come out with their status, and they're currently a really prominent advocate now against HIV and AIDS. Um, and that's been really helpful for media coverage as well. Also, Jonathan Van Ness, Queer Eye person. That's like an international show on Netflix. So them coming out with their status is huge, right? But I also want to speak to the fact that the three people I mentioned here, two of them are gender nonconforming. And I really want to point out the fact that, we're going to talk about this more later, but that's not really a big part of what the media seems to care about or cover. And I think that and the issue with that is a lot of people see these three people come out and they're like, see, like I thought, you know, gay disease, right? Um, like I thought, gay men deal with it most, et cetera, et cetera. And it kind of pushes this stereotype that's been really harmful to people dealing with HIV and AIDS. It's so inaccurate. Um, and it continues to ignore gender expansiveness. And I'm going to speak more about that later, but I just want to make that point here, um, that it is not just gay men or same gender loving men that deal with this. But not only that, but a lot of times the media will ignore gender expansiveness when it talks about HIV and AIDS. and that's really something that's gotta change. Okay, so the last picture here, I made it super general because that is how little coverage that we're getting on HIV and AIDS right now, 2024. It's not something you're going to see a lot anywhere. Um, and unless a celebrity is attached to the story, it is highly unlikely that you're going to see an HIV AIDS awareness kind of story or anything in like a top story today. It's just not common. So that's why I have this kind of like World AIDS Day general photo to just represent that. Okay, so um, studies show media and mainstream representation directly affect how communities respond to HIV and AIDS epidemic, and that's why I went through that history there. Um, for example, this picture here is from a documentary called Tongues Untied. It came out in 1989, around the same time that Keith Haring was basically the face of HIV and AIDS in LGBT communities. But this documentary was focused on Black gay men's sexuality and how HIV and AIDS overwhelmed the culture and caused a lot of fear and anxiety around sexuality for Black gay men. Marlon Riggs and Essex Hemphill, who made this film, they were both HIV positive at the time and they both passed due to HIV AIDS complications. So, again, marginalized communities have always been at the forefront of the discussion, but they don't always get the attention that they need. Um, so I just wanted to make that point. All right, so the first question, um, and I'm really curious, um, when you all had your first introduction to HIV/AIDS coverage in the media. So you are welcome to put your answer in the chat. We're gonna read a couple of them, a few of them, or you could speak, you know, whichever you prefer. But I'll start with mine. I first saw HIV/AIDS coverage in a rerun of the Hadea interview. Um, I was I was a kid at the time, and it's the first time I had ever heard of HIV and AIDS at all. And so my introduction to it was that kids can get it too, and it wasn't about the stigma around LGBT people having it. So I grew up knowing that, not having that stigma in my mind. But um, others of you are welcome to let me know where you
So,
first.
Jasper, so here in the room with me, Hannah, she mentioned Rent.
Mm,
And then for me, I would mention, this was before my time, but this is how I learned, but Queen, so Freddie Mercury. And then it looks like Nate said Magic Johnson on Channel 1 News at School.
yeah.
And then Jesse, go ahead, you've got your hand raised.
Yeah, for me it was on TV news, and it was through a story apparently of some guy that was uh out there doing sexual assault and also spreading HIV. So it was definitely in a very negative light. And even then, when I heard about it, I still didn't know what it was. I just knew it wasn't good, right? Just because of the way that they were framing it and talking about it. It wasn't until later on that I actually knew exactly what HIV was. But yeah, thank you.
Yeah.
We do have another entry in the chat. So Ray Rico had said Pedro Zamora. I hope I pronounced that right.
Yeah. Yeah. I really want to speak to like several of you mentioned kind of um, points that really speak to the stigma of HIV and AIDS. A lot of people's introduction to it is something that is just, either connected to something that is devastating or that is really, um, like really negatively affects the people that it's about. Okay, I see press conference in LA with Magic. Yeah, yeah. Um, So I think a lot of people's introduction can be alarming or could be something that you don't necessarily even know to look into because it's just like, wow, this is over here. And again, like the media has a lot of power in how it frames those stories.
There was a couple more drops in the chat. So Dr. Bishan had said press conference in LA with Magic, and then Sheree Hicks mentioned a different world cast and shared an episode where Josie tells her story about having AIDS.
Yeah. Anyone else before we move on? Okay, we'll go ahead and move on. Next. So we're gonna get into the state of media today, and how it directly affects how we talk about HIV and AIDS. Um, I'm gonna almost read this kind of word for word because it's really important. The United States is currently in a crisis of quickly declining trusted media sources, as well as growing local news deserts, right? And I'll talk more about that later. But this arguably shifts how people get their news, but not only that, how prominent misinformation in media is, because we literally have a deficit in trusted news sources, and people are turning to individuals and social media and other types of media for their news because they're not trusting what they're seeing. So we're going to get into some numbers and things to really break down what that looks like today. Right, as I said, I don't know why I put this slide here. Okay. Um, so yeah, HIV and AIDS crisis and the media by the numbers. So 1 out of 3 of newspapers and 2/3 of newspaper journalists are gone as of 2005, right? Um, Local news is just really at a deficit right now. And 50% or half of people in the US in a 2022 survey reporting having little to no trust of national news organizations. So the reason I'm putting these two together is because they are directly linked. Um, I know some of you might be like, I never watched the news. I've never read newspapers. I never got my news from there. And that's fine. Um, but the reason that local news is important isn't because of how many views it got or how popular it was, but it's because local news historically has been the nucleus of where all other news comes from. It's where national news gets its news. Without those feet on the ground, without those local journalists and local newspapers, you're not going to be able to get those really centralized stories that focus on um, cities that people may not be thinking about. So then national news ends up covering things that are so broad and not specific to specific experiences. And then you see this epidemic, um, and the epidemic is going as little to no coverage is covering it, right? So that pressure that we need to put on those in power to talk about these issues, we don't even have the resources to do that because local news doesn't have the resources to cover it, right? So that's kind of what those numbers speak to. Um, so this next number, Elizabeth thought it was a typo because it's ridiculous, but it's a real number. Um, there are 467% fewer, right, it's funny. It's funny, but not haha funny. It's bad. 467% fewer media jobs between 2022 and 2023. Um, this is devastating. This is horrible. This is bad. This really speaks to a lot of the misinformation we're getting now. It speaks to a lot of people not trusting news sources because we don't have those same skilled journalists and media people that know how to cite sources, know how to get down to the bottom of things, know how to create a story that people are really interested in. Um, Anecdotally, I have honestly 2 out of 3 of my former supervisors, editors that have been in the industry for 20 years now are out of work. There's so many stories that they would love to cover, so many important stories that need to be covered that they literally have nowhere to put. They're freelance right now. A lot of us are freelance and don't have um, a consistent publication where we can write those stories that are important, where we can talk to people living with HIV and AIDS and cover that and then have a lot of people read it. Those jobs literally don't exist, right? So that's just really, I think, something that we should all be really mindful of is not only are people moving away towards the news because they don't feel that it's um, as trusted anymore, but there literally aren't as many places to get trusted news, right? So 57%, nearly 60% of journalists, and I'll include myself in this number, are highly concerned about future restrictions on the freedom of press. Because you see this 467 number, what's replacing local news and what's replacing hard news is entertainment news and social media based entertainment and media, because that's where the money is. And obviously, with local news, there's never been any money in it. And that's a big reason a lot of these local news stations have closed. Um, so media is shifting from a news centered, news sites are shifting from a news centered focus to an entertainment and like building audiences, getting eyes on pages. That's been the focus now, not so much the news. So all of this is really relevant to why you're not seeing a lot of stories about things that matter to your communities. It's because there aren't as many spaces that care to share that kind of information. And people are feeling that. And that's why a lot of trust for the media is fading right now. So continuing that, um, 76% of HIV coverage in mainstream press um, has gone down since 2007 and it continues to decline. So I was talking about a little earlier um, about how in its earlier stages, you could see covers about HIV and AIDS, you could see top stories about it. These days, you're not really going to see that. It might be way in the back of the magazine, way in the back of the newspaper, if at all. You're not going to really see like top stories anymore, even though HIV and AIDS is literally an epidemic in this country. So it doesn't match the issue. Like the response to it in media doesn't match the actual issue and the gravity of the issue. Um, so this other number, 25 to 14, celebrities have replaced scientific and medical experts for any top HIV and AIDS related stories. So the reason that I brought up celebrities in the past slide is because right now, if you want a top story on HIV and AIDS, it's usually going to have to include an influencer, a celebrity, um, for any kind of media source to care about it. Because as I mentioned, media today is focused more on entertainment than it is news. So there has to be some kind of like uh, pop culture tie, unfortunately, for people to really want to pick up that story. Um, and that's, I don't want to say it's either good or bad, because I do think that there's a way that media can work with that and raise awareness with that. But that's just the state of things right now. Um, 2,500 adults in a recent GLAAD survey in the United States found that ignorance around HIV stigma is growing, not decreasing. And of course, looking at these numbers, that's probably no surprise to you, because where are you even going to see information about it to be thinking about it? If it's not at the top of your mind, if you're not already an HIV/AIDS advocate and that's something that you're focused on, you're not going to really even see stories about it enough to be like, wait, is this something I should care about? Is this something I should think about? So 72% of Americans identify TV, radio, and newspapers as their primary source of information about HIV and AIDS. Obviously, I'm sure many of you know, like, where is that information in TV and radio newspapers today? It's not, it's nowhere. As far as I know, it's nearly non-existent. So again, that kind of speaks to the issue we're having today. And then this other number, over 60% of Gen X, and we'll say Gen X is like 44 to 59, um, say they are knowledgeable about HIV, compared to only 34% of Gen Z adults, right? Or just Gen Z in general. And, if you think about the fact that 19% of new HIV cases are from young people between the ages of 13 and 24, of course they are, right? Because they don't have this information. They're not aware of the implications of the choices that they make, or the life, way that they're living. They don't even know to think about it. They don't even know to think about HIV and AIDS. A lot of them don't even know what that is. It's never been on their radar. They're getting their news from, no shade, TikTok, other social media, and they're not even knowing to think about this, right? So that's the issue there. I would say Gen X was alive in the 80s and the 90s. And so even if they're not getting that information now, even if they're not seeing HIV AIDS news stories now, they already have a foundational amount of information about it to be mindful of it, right? So I would say that's why that they're more knowledgeable, not because they're searching for news stories today, but because they already have that information. So I'm gonna move on to the next slide. So second question, and I'm very curious about this because as I was doing research, it was so tough to find news stories. A lot easier to find studies, but not news stories. The typical person doesn't look up studies, right? Um, but where do you find the majority of media coverage on HIV and AIDS today? And for me, I did, other than these few news stories I saw on celebrities over the past few years, I wasn't seeing much of anything on it. So if you all, like you did last time, you can put it in the chat or you can speak, and I'll go ahead and be quiet so y'all can respond to that.
So it looks like in the chat, Ray Rico had said in more movies now. And then we do have someone in the present in the room that has something as well.
Yeah, I'd say most of them are just the occasional commercial about a new HIV medication, and then there was a SNL skit following one of the Nevada commercials that was somewhat making fun of how bad it was.
And then Nate put in the chat and said that he does not.
Yeah. Yeah, I don't really either. I mean, I have seen commercials for sure, but um, media other than maybe like a few mentions in movies or documentaries, like actual news stories, or even in social media as something that comes up, it's nearly non-existent today. But yeah, if there's okay, someone else responding. Anyone else?
So there were two additional responses. So one, Sherry had mentioned you have to be looking for it. I definitely agree with that. And then look here in the room from Dr. Gar, he mentioned when research reporting about HIV cure is reported at conferences, a lot of media picks up on the story.
So just to give examples of, I think media, there's broad media coverage, but it happens to be around major discoveries or talks about cure, and it times with some of these major meetings. So it happens, but it's like more conference related spikes.
Yes. Yeah, there's not a lot of consistency in media about HIV/AIDS at all. It's a lot of, like you were saying, spikes of like, if a new study comes out or a celebrity speaks about their status or, something like that. There's not really a lot of commitment to consistent coverage.
There was one additional comment in the chat. YouTube or TikTok, maybe Instagram, Dr. Sebi talks about he found a cure for AIDS shared on Facebook. And did you have something else?
I was just going to ask a question.
Okay, go ahead.
Jasper, we could save it till the end, but is it okay to ask a question at this point?
Sure, yes. Not too many, but
No, not too many. Just related to what you're sharing, you set the stage so well for how there are no trusted sources, and it's very difficult times. During this time, do you feel the aspiration for constant media coverage or a more steady media coverage helps or hurts? Because right now, anything that comes in media, there is a spin that's put to it. It's related to political affiliations. If Taylor Swift gives a comment, it's about she's Democratic. So even about celebrities, they are being polarized into, they either have to be red or blue. So it's sort of a philosophical question, but would love to hear just what your thoughts are, which is this a time where it's more about grassroots level work, and being in the media can be sort of spun whatever way and hurts?
yes. And I'm actually going to speak about this a little later because I think one of the biggest issues we're dealing with about HIV and AIDS awareness is directly linked to media literacy and an inability to kind of understand sources, understand what is true and what isn't, what is a fact and what isn't. So it makes it a lot easier, of course, um, for news stories to get twisted and be taken out of context. So I think if anything, if there's going to be consistent coverage about HIV and AIDS, it also has to be paired with media literacy somehow. But I definitely want to talk about that later on. I'm gonna mention it a little more later on, but it's a problem for sure. Yeah, I'm gonna go ahead and move on, and we are gonna talk about that more later because that is a huge reason why we're where we're at currently. So local matters. Um, the ending the HIV epidemic initiative, which is EHE, that plan was created in 2019 during the Trump administration. And I'm sure many of you know this. It was created to reduce HIV infections in the US 75% in 5 years and 90% in 10 years. Um, and it focuses on 48 counties in the country, including Shelby County, right? Um, so it's an attempt to kind of like um, speak to these marginalized communities that have been um, disproportionately affected by HIV and AIDS during this time of like the global reframing that happened. So we're kind of returning to the US now after a decade of not doing that with the hope of helping. But of course, if the media is not on board with this and we're not getting kind of what we talked about, that consistent coverage and that those consistent updates, then it's really a moot point and we're not going to reach that goal that we claim to want to reach. So we're going to move on with that. So, and these are probably some statistics I'm sure a lot of you know, but just with everything that we talked about, I think it's important to go ahead and go over these again. So over 50% of new HIV cases annually come from southern states right now. Shelby County, I think, is number 2 in the United States for new cases. 40% from a 2021 study, 40% of Black people have new HIV diagnosis, despite only making up 14% of the US population. And then, you know, Hispanic and Latino people only make up 18% of the population, but account for 29% of HIV infections. So marginalized communities are dealing with this in a way that the media is not responding to necessarily, despite the, you know, administrations responding to it. And I think without that media coverage, it goes under the radar because, of course, marginalized communities in general go under the radar. So 21.6% of trans women in the United States are living with HIV. And this goes to this next question mark, because I have no numbers here, that even today, trans and gender non-conforming people get very little attention in HIV and AIDS studies. And this leads to very limited resources because a lot of times what happens is when these studies take place, there will be a really transphobic framing of, you know, trans men will be counted as women, or trans women will be counted as cis men, right? Or gender nonconforming people will be counted as whatever gender they were assigned at birth. So it's not that the information, it's not that studies are forgetting gender nonconforming people and trans folks. Well, let me reframe that. Like they are excluding. You know what I mean? So it's not that trans and gender nonconforming people aren't being included in these studies. They are just being, their gender is being ignored in these studies. I'll say it that way. The same with how the media doesn't really speak to the fact that the last few celebrities that have come out recently about their status, you know, the fact that they are gender nonconforming doesn't really get any kind of focus. So it's just that constant ignoring really leads to problems for those marginalized communities within marginalized communities. So that's definitely not something that needs to be addressed and resolved. And to that point, life with HIV/AIDS versus the numbers. Like we talked about all these numbers, right? And I think, I'm not sure who said it, but a few slides ago, we were talking about, you know, where do you get your news? And someone mentioned, you know, getting it from, you know, study updates and things like that. Numbers, a lot of numbers. And I think what the media could do better is, instead of focusing on those numbers when we do have those few stories that come out, is focus on the humans behind those numbers. Because these are real people living with HIV and AIDS. These are not, you know, just statistics. These are real people. And I think the journalists, you know, journalists and media fail to portray those living with HIV and AIDS in a human way. And so when people see these stories, they see numbers. They don't see people. You know, why care? This is a number. It's not me. It ain't got nothing to do with me, right? And I think that's why people are so drawn to those celebrities that come out with their status, because here is a real human being that I almost feel like I know, that is sharing this information with me, something that I could end up dealing with, or my family could, you know, or, you know, anyone could be affected. This person was affected, I could be affected. So I think there needs to be more human focus in these stories. So I'm gonna move on to the next slide to kind of speak to that. And I want to use, I'm a managing editor at Focus magazine, so I wanted to use myself and Focus as an example of how we can speak to that, to the humanity of these statistics, right? And I think Ray's on here, so he might even want to like say something about it. But so Focus is it's an art and culture magazine focused on the Mid-South and Shelby County and Memphis and this kind of like area um, focusing on LGBT people and our allies, right? But, even with us being an art and culture magazine, it is our responsibility, because we have an LGBTQ focus, to also include stories about people living with HIV and AIDS, right? Because that's a significant part of LGBTQ, a lot of LGBTQ people's experiences. Um, so I think it's the responsibility of any magazine that deals with LGBTQ issues or topics or anything, even if you are not the news, because we are not the news. It's a part of our culture, right? And I think that there um, is an importance for us to destigmatize by including these stories the same way we would include a drag show coming up, or highlighting someone that's about to do a performance. Like, all of this, destigmatize it, because people are living with HIV, right? They are thriving with HIV. So we got to start talking about that. And an example of that is Ray Rico, which I do think is on here, but I'm not gonna bother you. I'm gonna let you sit. Uh, Went to Day on the Hill in Nashville recently, and we covered it in the magazine. And speaking of that, like, human focus, uh, in our story, in our coverage, we talked about LaShonda Salinas, whose name I hope I'm saying right. She was the first person to be removed from the sex offenders list in Tennessee for not disclosing her HIV status. Um, and so we talked about her story, because here is a real person living with HIV and being stigmatized to the point of criminalization, right? Um, and when people read that story and see this human person, um, it's like, oh, like, I can't believe that that happened, but it's happening, or it has happened. So that's kind of an example of how we can incorporate those stories in a regular basis. And then also we have the Refocus podcast. It's called Prepped: Sex, Stigma, Science in the South, which of course talks about HIV and AIDS and people living with HIV. Um, and we also have like By the Way, which is a bi-weekly newsletter. So whenever there are HIV/AIDS awareness events, we include those the same way, again, we would include a drag show or whatever, because it's all connected. Like, we, all the same people should be just as interested as to attend that event as they should want to attend, any other event that speaks to our community, right? So I'm gonna go ahead and move on with that. So, what we talked about earlier is like, how can media help in the stigma, and promoting media literacy is a huge, huge, huge part of how we can do that. Um, it's very, very significant. And wait, let me make sure I'm looking at the right thing. So 2/3 of kids in the US cannot read fluently. 1 in 5 Americans in general have a low literacy skill. And so when you talk about like this issue of misinformation and getting your news, again, my dog, I'm so sorry, getting your news from social media, there's less of a draw to care about facts. It's more about like, was this entertaining to me or was it not? Moving on. And I think, moving to this next thing, we can really work with social media um, to promote media literacy when it comes to HIV/AIDS, to make it relevant to audiences that usually don't even think about it, right? And then finally, practice persistence. Like I mentioned with the Reagan administration being pressured by the death of Rock Hudson to talk about HIV and AIDS in a more prominent way, that pressure from media is the reason that happened. So it's got to be a persistent pressure. It can't just be a touch and go. It's got to be constant. for those in power to actually care about it. So, a path to a more inclusive journalism when it comes to HIV/AIDS. It's really important for people to follow organizations like End HIV 901 and to not just follow but to interact and engage, because so many of us are led by algorithms today. So many of us get our news from social media. So it may not seem like it matters that much, but if you are um, sharing information from those organizations that are on the ground, that could take the place of what honestly local news would have been doing if we had more of those resources today, right? So there are ways to kind of make sure that people are always seeing, because I'm thinking of this idea in sales that, people have to see what you're selling and see your pitch about 7 times before they actually consider buying it. The same is true for a lot of media. You have to see it constantly for it to finally click, like, oh, I maybe should care about this. Let me click on this. Maybe I should look into it, right? And then of course applying that pressure. Um, I mean, when I say applying that pressure, I mean even with me being someone in media, uh, journalists have a responsibility to respond to the communities that they are a part of. Um, and so I don't know if a lot of you know about this, but a lot of editors get pitches, right? Pitches to their emails talking about things that people want us to cover. And I really want HIV/AIDS advocates to know that you can also send a pitch about a story you want us to cover. You can also send a pitch to the Daily Memphian and say, hey, this thing happened, and um, it is affecting our community, and it needs to be a story. You can send those emails. You don't have to be a writer to send it. You can be a community member and send those emails and say this needs to be talked about. But also applying that pressure to influencers and people in power in social media to talk about these things with their audiences who may not be thinking about it. So include and remember kind of speaks to that as well. And of course, center people, not numbers. Not that the numbers aren't important, they're very important, but I don't think that news stories or media can focus just on the numbers. It has to be, here's the statistic and here's a direct example. Here's a human story that speaks to that number, right? And then, of course, community engagement. I'm from Memphis, just moved back around the pandemic. That was my excuse for not going anywhere. I don't have that excuse anymore, even though pandemic, is still here. COVID's still around. But I say all that to say people in media and HIV/AIDS advocates have to bridge that gap. you know, there's this thought of like silos and living in your own spaces and only responding to those emails and not stepping out and going to those events and speaking to real people. So it's definitely the media's responsibility now, especially without those local news um, resources that we once had, to really be on the ground and to interact with those people directly affected by HIV/AIDS. Um, so yeah, that I believe is my last slide. So I'm going to open it up to discussion or questions about what you all feel journalism and media can do to better raise awareness about HIV and AIDS. But yeah, thank you all so very much.
There was a mention in the chat just now from Sherry Monroe that said it's a quote, the sales department isn't the whole company, but the whole company better be the sales department.
Yes, exactly.
And then there's also a comment from Sierra Harris that says, beautiful job, Jasper. Thank you so much. And I definitely share her sentiments. You did amazing.
Thank you. Thank you. Thank you.
But of course, anybody can come off mute and ask questions if you have any questions.
Jasper, it's Ray. I think you did a great job today. Thank you for the presentation. It was very informative and educational. If somebody on the call or somebody in the community wants to share information, not just to you or to Focus, what advice would you give them for, putting something together to solicit some coverage?
That is a really good question. Thank you. Thank you, Ray. And thank you for saying that. I would say, again, Focus is an arts and culture magazine, but that doesn't mean that we can't find creative and interesting ways to talk about HIV/AIDS and raise awareness, right? So if you feel that there is a story that we should be covering, it's really up to us to figure out how to frame that story. All you have to do is think it's important, right? So if you feel that it's important and something that we should cover, you can simply just like email us. Actually, let me let you know my email is editor@focuslgbt.com. And I guess I could probably send that when we send this PDF. But all you have to do is believe that the story you're talking about is important. And then it is our job as the media to decide how we can frame that in a way that speaks to us as a magazine and speaks to our audiences, right? And I won't say that it will always make sense as a story for us, but it's definitely our job to figure out how it can, especially with this being such a prominent issue in Shelby County and in our communities. So you could just, send an email saying like, um, this thing has happened, or this person that I know wants to speak out about HIV/AIDS. This person is living with HIV/AIDS, and they would love to do a story in your magazine, or they would love to be interviewed, or something like that. And then it'll be my job to figure out, like, okay, what's the best framing for this? How can we write about this? Who can I assign to write this, or should I be writing it? That kind of thing. So it's really a collaborative process, but it starts with what you feel is important and what you feel we should know about.
We've had a continuation of gratitude and thank yous and appreciation for your presentation in the chat. And then there was one question. There's a mention of how are we going to community engagement.
I'm sorry, say that again. How are we going to?
So, like, I read it exactly how it's typed, so I'm not sure if Elizabeth Anderson can come off mute and wanted to ask the question herself to elaborate.
I just want to know how we're going to do our community engagement, like to the ending, or we trying to get less people living with HIV and AIDS. I just want to know how we're going to engage our community.
Yeah, yeah. So I think a big part of that, because I believe it's like 1 out of 5% of all people get their news from social media, and it's even more for younger people. I think it starts there. I think if we can find a way to connect with people that have large audiences, and to see if they are willing to take the responsibility of like raising the discussion, um, I feel like that's a wonderful place to start, is to, reach out to people that already talk about issues in our community and say, hey, this is important too. Are you willing to collaborate with us and talk about this thing with your audience? Um, and I think starting there, it'll already, because I talked about earlier, like celebrities, unfortunately, are where a lot of people find their trust in rather than news sources these days. So I think because of that, a lot of influencers and celebrities do have a responsibility to speak to issues like this.
And then I do have a quick question. So there was one slide where you talked about 62% being knowledgeable. I believe it was the Gen X generation that was knowledgeable about HIV/AIDS, and then it moved into Gen Z. What about, like, is there anything out there about the millennial generation? Because I'm assuming I'm not really good at the labels, but I believe that's that generation that's between the Gen X and the Gen Z.
Yes, yeah. I didn't see anything specific about it. I did see general information about there being a general decline as generations go down. I'm a part of the millennial generation.
Same.
Um, yeah, so because that generation grew up with print media and digital media and was on the like cutting edge of digital media, um, the media literacy for that generation is a little higher than it is for younger generations. Like for example, I my first introduction um, to HIV and AIDS was through that Oprah interview, right? So we have a little more context than younger generations do. So my guess is that we have a little more knowledge, but I don't have direct numbers on that.
Thank you so much. Any other questions from anybody?
A quick one. So Jasper, great job, amazing presentation. Mention algorithms, right? So we're talking, Gen Y, Gen Z. To everybody's point, it's social media, and you kind of get fed the news that you like. If the algorithm sees that you like seeing news about sports, you're going to get more news about sports, and that's kind of this vicious cycle that Obama kind of mentioned on his way out of office, that this is what he saw was happening, and it's continued to happen. That being said, because it's an algorithm, these type of things can be manipulated. I know that there are all these SEO operators and so on and so forth. Have you heard anything, or do you know anything about going to the, essentially the SEO people, like, hey, in, say, for example, the EHE counties and those EHE states, how do we make sure that this type of information is popping up? Like, did you know that you live in a county where the chances of you acquiring HIV are 30% higher or 50% higher than living in a county that's, 30 miles away or something like that? Is there any thought process to doing that, to where you would have things like Focus Magazine or EHE 901 pop up in people's feeds, even if it is advertising in those specific counties?
Yeah, yeah, that's a really good question. Yeah, I haven't directly thought about reaching out to the CEOs, mainly because to me it seems like the easiest route into breaking that algorithm is to um, is to address those people who have more control over our algorithms than we do, which would be those influencers, right? Those people that have a major audience and that talk about a wide range of subjects. Um, but I definitely think that like maybe even an easier route if the finances were there would be to have ads and to direct those ads specifically to the audiences we wanted to do that with, because luckily with ads they surpass algorithms because you decide who you want your audience to be. You can decide for this to be specifically for 18 to 24-year-olds if you want. You can decide if your ad is going to be for people who live in Memphis or people who live in southern states. So that's up to you. So that would be a way to kind of control the narrative. But the only thing about ads is people aren't as likely to interact with them as they are with a person. um, I think TikTok has done a good job of like figuring out a way to make ads intriguing. But if you'll notice in those really popular TikTok ads, there's gonna be an influencer in that ad. You know what I mean? So I really feel like at the end of the day, it's going to take those people that already have those big audiences to bring in that conversation and to kind of get it going.
Other thoughts from anybody else? Questions, comments? You've had another a gratitude of appreciation in the chat as well, of course, for a couple. Okay, well, with the silence, that's where I am gonna say, Jasper, you dropped your email, like you mentioned it by voice, so I did drop that email in the chat. So that's the editor email for Focus Magazine. So as Jasper mentioned, that's a potential a potential for people to submit things that, that you as the public think that need to be covered. Any last thoughts, Jasper, that you want to share?
I want to thank you all in HIV 901 and all of you for creating the space for this discussion. It's so important, and it's something that I even learned a lot about as a journalist looking into this. And even though there's a lot of alarming numbers, I'm grateful that there's clearly a community of people that care a lot about this to push the conversation forward. So thank you all for this space.
Absolutely. And we thank you, Jasper. And I definitely shared all the sentiments in the chat of how amazing this presentation was. It was so thorough, lots of information, lots of good topics of discussion that came about. It was very informational, and I'm very appreciative. But with that being said, I will drop the last note of thank you, everybody, for joining us. And with that, be adieu. And we appreciate and hope that we can, that you will join us for our next technical assistance training coming up. And everybody have a good rest of your day.
Thank you all.